a really big problem that I see many times is cytomegalovirus can cause autoimmune disease in people. It's very common. You could get rheumatoid arthritis diagnosed, or you could get lupus diagnosed, or multiple sclerosis. These all attack different organ systems throughout your body. And then you get the testing that comes back and says, oh, you have this medical condition. I'm Dr. Jake. I'm a naturopathic medical doctor. And on this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Be sure to subscribe for some more videos like this one. Okay, let's jump in. Yeah, let's start talking about, is there a difference between acute cytomegalovirus and chronic cytomegalovirus? And there is. Acute cytomegalovirus is pretty much typical kind of flu-like symptoms that someone will experience. They will experience a fever, chills, body ache, sore throat, headache. Doesn't usually cause any severe symptoms at that time. Sometimes it can, like anyone with any type of flu-like illness, if they're prone to it. But typically people get it, they get over it, and it goes into a dormant state. That's something to really talk about with viruses too, is a virus doesn't totally get eliminated from your body. It goes in a dormant state and it actually makes up DNA of our body. So every tiny little virus we ever get exposed to makes us a new human because we have different DNA and makes us different. So that's an interesting thought there. But what can happen is you can then have this acute exposure and that can turn into chronic CMV. You could either get the acute and then it goes into chronic. So you never got over cytomegalovirus ever. That's the less common. And most of the time you get it, maybe a week or two, you have the symptoms and then it goes dormant. And it will do that for years. And then it can reactivate itself. And that most common way I see reactivation of cytomegalovirus is just chronic stress. Also, if you get exposed to a bad bug, most recently what I'm seeing is people getting exposed to COVID-19 reactivates cytomegalovirus. Or you something just happened in your body that suppressed your immune system, and now it's not keeping it at bay, and now it's reactivating. So, what are symptoms of chronic cytomegalovirus? So, this all depends on what organ system is it affecting. So, with chronic viruses like cytomegalovirus, it will affect multiple organ systems. So, let's say it can even affect your eyes and your neurological system. So, if it affects your eyes, you could get eye floaters, you could get some blurry vision. Affects your brain, you could get headaches, you could get peripheral neuropathies, numbness, tingling. It could even affect your mood because it causes this chronic inflammatory response to the brain, causes dysregulation of your neurotransmitters in your brain, and that can lead to depression, anxiety, sleep disorders, etc. So if it affects the gut, diarrhea, constipation, nausea, stomach aches, whatever, on and on and on. Depends on what area it affects. And many times when people are like chronically ill, they might be looking up certain chronic infections and they might go on cytomegalovirus, and be like, that sounds like me. It could be cytomegalovirus, it could be some other virus, or it could be other bacterias or parasites, whatever, because these chronic bugs, when they go chronic, is they affect multiple organ systems. But we do need to find out, you need to go to the right doctor, identify what specific bug this is so we can effectively treat it. So let's talk about if someone has chronic reactivated cytomegalovirus, are they going to be spreading that to family members? Most of the time, no, except moms that have kids sometimes can transfer that to their kiddo. So that's a really unfortunate thing. You have chronic cytomegalovirus that's not in the dormant state. It's reactivated. You could get pregnant and you could spread that to the newborn, and that's bad news. So that's one really bad thing that can happen with cytomegalovirus is it could cause birth defects or the child is born and then they have chronic cytomegalovirus, and it's usually a lot more severe in the little babies that have cytomegalovirus. But otherwise, it's not spread the same as like an acute reaction of cytomegalovirus. Now, what can happen with some people, what I do see is it can transfer if someone has elevated IgM antibodies. It's telling me more it's in the acute phase than the chronic phase. So people could have chronic and acute exposures that I see going on with their immune systems. And they do have that elevated IgM. I do see that that's very likely that they could spread it. And it is spread through the saliva, urine, semen, etc. But majority of people don't have that, and they have just chronic IgG cytomegalovirus. The antibodies are way high, and that doesn't cause the spread. So most people aren't going to have to worry about that and be concerned that they need to go isolate themselves during when we're actively treating cytomegalovirus. So let's say you go to a regular doctor and for some reason they ordered cytomegalovirus, which I doubt many are going to do that, except if they're specialized in chronic illness and understanding of what's going on. But sometimes it's done. They order cytomegalovirus and they see that you have elevated IgG antibodies. Majority of them that don't really have good understanding of what things look like when someone has chronic reactivation of cytomegalovirus, they're just going to say that you have antibodies to it, you're immune to cytomegalovirus, and you're good to go. So if they see an elevation of the IgM antibody, they're going to be really concerned about, oh, shoot, you have a acute cytomegalovirus. Most conventional MDs don't even think bunch about chronic CMV at all. They don't really have any understanding of it, how to approach it, and many of them don't even know it exists. Now, there are doctors that specialize in cytomegalovirus that are conventional MDs, and they know what's going on. But if you go to the typical doctor, they really don't know what's going on. They don't know how to diagnose it appropriately. So, me as the doctor, when I'm seeing it and when I'm ordering it, is I see a certain symptom picture, like they have all these organ systems that are affected. They have this chronic inflammatory response. That's when I'm going to be ordering the test. And that helps me see, okay, you have the symptoms that look like it. And now I'm seeing your cytomegalovirus antibodies are really high. They're greater than 10. Now, someone that has just doesn't have greater than 10 and they're like 8 or 7 on their antibody levels, that's when I'm like, yeah, probably you don't have it. It's just like you have antibodies to it and it's not really a concern. So that's how I decipher. I base it on symptoms and then the high antibody count that I see on the IgG or IgM. What is the most common number I see with the reactivation of cytomegalovirus? I'm seeing an antibody level that's greater than 10. Now, that's what the lab corp shows. There might be other labs that test it differently, but I typically order it through LabCorp. And unfortunate thing, I wish they tested above 10, right? And give me an exact number because then I could actually track perfectly when we're doing treatments before gets below 10. So someone could be like 2000, but it's just saying greater than 10, right? But if someone is greater than 10 and they show symptoms correlated to it, I'm definitely treating them from chronic cytomegalovirus. What is the long-term side effects that can happen if you don't get chronic cytomegalovirus under control? Is usually your symptoms are gonna get worse. So and this is what a really big problem that I see many times is cytomegalovirus can cause autoimmune disease in people. It's very common. You could get rheumatoid arthritis diagnosed, or you could get lupus diagnosed, or multiple sclerosis. These all attack different organ systems throughout your body. And then you get the testing that comes back and says, "Oh, you have this medical condition." And then the conventional approach to treating this medical condition is usually through an immunosuppressing medication of some sort, Humira, methotrexate, maybe prednisone, etc. And we're talking about a virus, right? A bug, and we need our immune system to attack that. So they could prescribe an anti-inflammatory agent that suppresses the immune system, and you could symptomatically feel good for a bit. But the cytomegalovirus is just gonna get worse and worse and worse, and then you're gonna start experiencing other symptoms besides just the inflammatory symptoms that could go along with that, or the medication stops working at all, and the Humira methotrexate stops working, and you don't know what to do at that point. So things can just get worse and worse and worse, and a lot of those symptoms I just talked about just keeps getting worse. And if it stays too long and if damages too many different organ systems, you could eventually get to a point that you're really chronically ill, you can't really function. You might even get to a place that you might pass away from this. So it's not a small thing. You definitely need to take care of it. I would say most people don't pass away from it, but they get to a point of really non-functional fatigue, can't get out of bed. They might get lightheaded, dizzy, and faint all the time. Like this could be a possible cause of POTS, for example. So, yeah, we want to get it taken care of and diagnosed appropriately. So, let's talk about what I do for chronic cytomegalovirus. And if there's a difference with acute and chronic, I'll address that and talk about what I do there. Also, I'm going to be giving a list of several different supplements. You could actually see in the show notes all the supplements that I am going to be talking about today and have the links for them too. So, make sure you take a look at that. So, let's start with monolaurin. I love this product. I prescribe it for most of my chronic viral patients. It has a strong antiviral action. It even does have a lot of antibacterial action too. And this comes from coconut. So if you have a coconut allergy, you definitely could take monolaurin. We're just taking out the direct monolaurin, which it comes from other things besides just coconut, but that's usually where we get it. It has a strong antiviral replication effect. So it doesn't directly kill the virus, but it keeps it from dividing and growing and getting bigger and all over the body. So I love monolaurin for that. Now let's dive into a couple of herbs I'm going to talk about. One I want to start with is cat's claw. This has a lot of great research for herpes simplex virus type of viruses, and cytomegalovirus is in the herpes family. And this is highly effective against that family of viruses, herpes virus, cytomegalovirus, Epstein-Barr virus, etc. So what's great about this is this will has antivirucidal action, meaning that it will directly kill the virus. So monolaurin is going to decrease its replication, then we're going to directly kill it with the cat's claw. And what's great about cat's claw, and we're going to talk about a lot of the herbs and nutrients that I'm going to talk about, they have anti-inflammatory action. So a big thing that cytomegalovirus does is it causes inflammation throughout your entire body and causes damage and inflammation in multiple organ systems. So if we could use something that actually kills the virus and then actually decreases the inflammation at the same time, that's the best treatment that we could get. So cat's claw is awesome for that. Next one is skull cap. Skullcap works similarly to cat's claw, but a little bit differently. It has a great anti-inflammatory action, so it's great like cat's claw in that way. But skullcap also has changes gene expression of the virus. It also has antiviral replication effects and virucidal. So it has all three different effects that it has on the virus. So I love to do a combination. I usually just don't prescribe one at a time. I'm prescribing several different things. And I actually created a product called Virus Shield, whereas at this exact doses that I want of these specific herbs and nutrients that I have to make it be able to go after this cytomegalovirus. So now we're going to dive into nutrients. I'm going to have a big list of several different nutrients, immune stimulating, antiviral type of nutrients. Let's start with vitamin A. Sometimes people think of it as an immune nutrient. I don't hear that from a lot of people, but some people know about it. But it's an extremely strong antiviral agent and it has anti-replication effects on the virus. It also has anti-inflammatory effects. Then we dive into vitamin C, which is really awesome. And vitamin C works at making your immune system stronger. It gives your immune system the guns to be able to fight the immune system off more effectively. It also works by increasing a lot of parts of your immune system that are really effective on killing off viruses, like natural killer cells and certain T lymphocytes. So it's a great immune stimulator, which does things differently than the other treatments I just barely talked about. Is it's really great on making that immune system work more effectively. And it has anti-inflammatory action too and antioxidant action, which cytomegalovirus causes a lot of reactive oxygen species, which is one way that it causes damage of the multiple organ systems throughout the body. So we want a lot of antioxidants too. Vitamin A also is an antioxidant. Now let's talk about zinc. Talking about antioxidants, zinc is a strong antioxidant too. But zinc, how it works is it binds to the outside membrane of the virus and prevents its action, decreases how it works. It's not able to do what it wants to do. It's not able to replicate and grow out. So it's not able to grow and be effective. And then all the other things that we talked about that actually kill the virus are able to mop it up and take care of it. Zinc also is an immunomodulating nutrient, and it's really good on decreasing the inflammatory responses throughout the body. Next one is quercetin. What's great about quercetin is it acts as a zinc ionophore. What that means is it's going to help zinc actually get inside the cell more effectively and affect the virus better and keep it from replicating. So during like the COVID-19 pandemic, this was becoming very popular and people started talking a lot more about this. I knew this for a while, the as quercetin as an ionophore, but it started getting really popular during that time. And maybe many of you listening to this have heard of it as quercetin as a zinc ionophore because of that. But it's really great combination with zinc. It works really awesome against this. But also what I like about it is people that get cytomegalovirus, they tend to produce way too much histamine. They tend to start getting all kinds of allergic reactions to all kinds of things and also to a lot of different foods. They might not notice that it's a histamine response in the beginning, but quercetin is really great on subduing that histamine response. It's one of my favorite treatments to decrease chronic histamine disorders, the histamine that's being produced way too readily. Next treatment that I want to talk about is our beloved vitamin D. I'm sure many of you have heard about vitamin D. We need to keep our vitamin D strong because we have a strong immune system. Vitamin D is actually not really a vitamin. We should really change the name because it acts more like a hormone. It is our immune modulating hormone. So if we have too little vitamin D, guess what? Our immune system's not going to work right. We're not going to be able to fight off infections. And also, we're not going to regulate our inflammatory response that's happening throughout the body very well. So we want to make sure we get a vitamin D level on your blood work of at least 50 to 70. That's bare minimum for where I want it to be able to actually have that anti-inflammatory effect and also support your immune system and make it strong to be able to go after killing the cytomegalovirus. Do I vary doses for depend on the person? 100%. I change the dose all the time. And many of these doses I'm gonna give you can be possibly harmful if you don't do them right, especially regarding vitamin A. So I really wouldn't just I'll give doses, but you really need to go to a doctor that knows what they're doing, so you're actually able to have a good effect and have the appropriate dose for you. Yeah, so those that are interested in getting treatment for cytomegalovirus, they can visit my website, integrativemedica.com. Find my phone number there, give my receptionist a call and set up an appointment with me. You could also set up an appointment directly from the website. If you want to learn more about CMV, EBV, or other chronic infections, click my videos to the right. I'm Dr. Jake, and I'll see you there.